Hello, friends, and welcome back to my channel. Hope you guys are doing well and enjoying the holidays well. For me, the time for holidays is over. I'm already in the next classes. So, some friends told me that they couldn't understand the Leopold Manoeuvre from the last day of the school. So, I guess I have the simplest and easiest explanation for now. So, let's have a look over it in just 3 4 minutes. If you want to hear the definition of the Leopold maneuver, so it's the systematic method of the abdominal palpation used to assess the fetal position, presentation, engagement, and we do it in the third trimester only for the pregnancy or the pregnant mother. And reminding you about the third trimester is from the 29 weeks to the 42 weeks. And I was just reading about the my Indian book, and I just came to know about the fourth trimester is also over there, which is new for me to hear. That in fourth trimester is 12 weeks from the date of the delivery, like the delaying of the date of the delivery, in which mother as well as the fetus both will face a lot of problems over there. So we got the fourth trimester also nowadays. Let's see about the Leopold maneuver. So we have some four pelvic grips over there, four pelvic grips to check the fetal lie presentation and if the head is engaged for the delivery or if the head is below table or not, like that. So the first one, let's see about the first one. The first one is the fundal grip. We call it fundal grip, which tells us about the lie and the presentation. So if the head is over there, I'll show you in the photo. So for example, we put in the first one, we put our hands on the fundal part of the uterus of the pregnant mother. And if the head is over there, the head is going to be seems like hard and regular, but if the buttocks are over there, so buttocks will be soft and irregular. So it tells us about if the presentation of the fetus is cephalic or breech exactly. So this is all about the first one. The second one says about the we put our hands, one hand in the lateral one in the lateral position and the second hand near to the umbilical part of the mother. This is how we put our hand. So the second grip is known as lateral or umbilical grip, either side of the maternal abdomen position and the back of the fetus. So what we check in the second one, we check that if the spine is over there, like in which side the limbs are over there, in which side the spine of the fetus is over there. So if on the particular side, if we see that the spine is over there, so the spine seems to be curved or regular because it's the hard part, yeah. So the spine seems to be curved and regular on the either side of the female's part, and if the limbs are on the side in which we are palpating, so they will seem like knob-like or irregular-like. So we get some idea about this, that in which side the fetus is facing while putting our hands on the lateral and umbilical side. The third one is called as Pawlik grip, or we call it first pelvic grip. So, about this, let's look at the third one. The third one, we put our hands near to the pelvic region and we try what? We try to move the head of the fetus. So remember about this, that the third one is so uncomfortable for the pregnant mother. So if we try to just imagine that if we try to move the head of the fetus in the uterus of the pregnant mother, will it be even comfortable for her? Not at all, I see. So, but this is our protocol. So, in case if the Pawlik or the first pelvic grip is asked by examiner in case, so it tells us about if the head is ballotable or not. If the head moves, it means it is ballotable, yeah. It is not yet engaged into the vaginal passage for the delivery. And if the head does not move, we call it non-ballotable. It means that the head is engaged for the delivery in the vaginal portion. So look at the picture once again, and let's see the fourth one. So the third one we named it as Pawlik or first pelvic grip. The fourth one is named as the second pelvic grip because it's something like the Promax version of it. The fourth one tell us about the third one as well. So let's see. The fourth one, it's the second pelvic grip. It also tells us about if the head is engaged or if the head is not engaged for the delivery in the vaginal portion, in the vaginal passage. So what we do is we try to put our hands near to the vaginal portion and we try to converge our fingers. It's written over here as well if you want to read that if able to converge the fingers below the fetal head, then the head is not engaged. And if we are not able to converge our fingers towards the head of the fetus, it means the head is already got engaged for the delivery in the vaginal portion for the fetus. Yeah, but remember, things to remember is wait, see the photo of the fourth one that this is how we try to converge our fingers. So this is gonna tell us because the head is going to be seem harder for us, and this is going to tell us about if the head is engaged or not as well. So the thing between three and four are a bit similar and same, but remember that the fourth one is more comfortable for the patient. And one more thing to remember is when we are performing the Leopold maneuver 1, 2, and 3, look at this that we are facing towards the where we are facing towards the head of the female. So look at the 1, 2, and 3 that we are facing toward the head of the female. But in the Leopold maneuver 4, we are facing towards the legs or the limbs of the female. So this is how it is performed scientifically nowadays, and this is all about the Leopold maneuver. If I will get some more time, I'll try to post more videos for you. But let me know in the comments if you are facing some major difficulties in any question. I will be there to post some more videos about it, and I will be there to ask or answer your questions. So this is all about this video. Hope you enjoyed it. Thanks. Have a nice day.